Now we will discuss about the vitamin B1. It is also called thiamine. Function of vitamin B1 in thiamine pyrophosphate TPP, a cofactor for several dehydrogenase enzyme reaction. It is in thiamine pyrophosphate TPP, vitamin B1 acts as a cofactor for several dehydrogenase enzyme reactions. BAPT. B is for branch chain keto acid dehydrogenase. A for alpha ketoglutarate dehydrogenase, that is in TCA cycle. Pyruvate dehydrogenase links glycolysis to TCA cycle. Transketolase, it is in HMP shunt. So deficiency of vitamin B causes impaired glucose breakdown, leads to ATP depletion worsened by glucose infusion. So when glucose infusion is given, so it causes ATP depletion because glucose breakdown is impaired in vitamin B1 deficiency. Highly aerobic tissues like brain and heart are affected first because of ATP depletion. In patients with chronic alcohol overuse or malnutrition, give thiamine before dextrose. So if patient is chronic alcohol overused, abuser or malnourished, so we will give thiamine before dextrose to decrease risk of precipitating Wernicke-Korsakoff. Diagnosis of vitamin B is made by increase in RBC transketolase activity following vitamin B1 administration. So when vitamin B1 is administered to the patient, so we will increase the transketolase activity in the red blood cells. Now we will discuss about disorders of vitamin B1 deficiency and their characteristics. First we will discuss about Wernicke-Korsakoff. Acute, reversible, life-threatening neurological condition. It is a neurological condition that is life-threatening, reversible and acute. Symptoms of Wernicke-Korsakoff are confusion, ophthalmoplegia, that is eye problem, there is their eye muscles problem. Nystagmus. Nystagmus is abnormal movement of the eye or like vibrations. Ataxia. Abnormal walking is impaired. A person cannot properly walk in ataxia. Korsakoff syndrome. It is another disorder of the vitamin B1. It causes amnestic disorder. What does it mean? Amnestic disorder are disorder related to our memory due to chronic alcohol overuse. It presents with confabulation. What is confabulation? So patient has memory disorder and it creates stories from himself. It's confabulation. Personality changes and memory loss. Memory loss is prominent in Korsakoff syndrome, and personality changes also take place in Korsakoff syndrome. Wernicke-Korsakoff syndrome. So this is Wernicke-Korsakoff syndrome. Damage to medial dorsal nucleus of thalamus. Medial dorsal nucleus of thalamus and mammillary bodies. It leads to Wernicke-Korsakoff syndrome. Its presentation is combination of Wernicke-Encephalopathy and Korsakoff syndrome. Dry beriberi polyneuropathy, symmetric muscle wasting. It causes polyneuropathy and symmetric muscle wasting also takes place in dry beriberi. Spell beriberi as berry1 to remember. It is caused by vitamin B1. Wet beriberi, high output cardiac failure. It is high output cardiac failure due to systemic vasodilation. Wet beriberi is due to systemic vasodilation. Polyneuropathy is problem in the nerve. It causes pain in the hands and feet, and it also causes symmetric muscle wasting in dry beriberi.